So for those who don't know me, I'm Jolie Rollins. I've been with Patagonia Health now for about 6 years, but I've got many years experience in healthcare and specifically in EHRs, kind of problem solution type of work that I do here at Patagonia Health. And I want to start off by saying, boy, those of you who made it today, thank you. Right. This had to be moved so many times, and I'm super appreciative. I will just let you know that I think one of them had to be moved because my stepdad was having a pacemaker, which of course got moved. But now it's better. He's going to have it on the 25th, and he's going to have it at a level 1 trauma center. So I feel much better about that. And then I was sick. I'm still sounding kind of congested. So I really appreciate y'all. I had no voice. I got on a meeting with Denton, and I couldn't even speak. He was like, yeah, we're definitely going to have to move it. So thank you. Right. So I'm here to answer any and all questions, not just about the time and effort app. I'll do my absolute best to answer your questions. And I really appreciate you guys all being here today. This is going to be interactive. If you've met me, you know this is going to be interactive. And so just before we get started, if you want to type into the chat for me, tell me what you're hoping to see here. Maybe there's a program that you're thinking about that you want to use this for. I know that in some of our states like New York and Wisconsin, you can get some extra reimbursement if you can track some time and effort. And I'm just curious to hear what you might be, what are your aspirations for this meeting? And thank you for attending. And while you are typing that in, and it's just in the chat screen. So if you just want to type in that chat screen, that would be awesome. That way I can try and answer your questions. And maybe you're just here because you just don't know and you just want to. So this is your time. I'm going to go ahead and jump in. And those of you, if you're not familiar with time and effort or not familiar with Patagonia Health, we are a public health and behavioral health specific EHR. We don't play in the ambulatory. We don't play in home health. We are specific to public health and behavioral health. We're apps-based, which is unique. So if you think about just like you download apps on your phone and you can arrange those in the order that you like, we do the same thing. So we call that personalization. So each user can have their own unique workflow without having to change the system. I've worked, I know about 9 EHRs, and some of them have the tabs where you have to go through each and every tab. And we try not to dictate to the user. We try and let the user have the experience that they need in order to do their job, right? So we're on the dashboard. This is one of the big screens that we can see. And Denton, if you just make sure I'm showing my screen, I think I am. When I can't see it always, okay, it says I'm sharing. So I'm on my dashboard, and I want you to think of this as like your desktop, right? So this is where I start my day. When in between seeing patients, I come back here to pick up work or messages or things like that. I have things set up here. Oh, hey, Julie, good to see you. And thank you so much. And my screen is showing. You guys rock. Thanks so much. I'm curious to see the features in the workflow. Awesome. Thank you for showing up. And again, I know you've had to jump through hoops to get here. So much, much appreciated your patience with me being sick and everything going on. So this is your dashboard, right? So this is where you start your day. This is where you come and pick up work. And I've got this set up to mimic. Thank you, love. I've got this set up to mimic what would be like a case manager. Case management, think of care coordination, right? And so I love it when people say to me, Jolie, do you have case management? And I say, it depends, right? Because case management is in the eye of the beholder. What type of case management do you do? We can do everything from maternal child health to BSEP programs to non-clinical programs that may be in your public health department as well. And the time and effort really helps us with that. So let me go through just a couple of things that we've got today. I've got this upload document, right? So this would be if I were bringing in outside work. Maybe the patient was referred to me and they have some paperwork for me. Maybe they're providing me some lab results or anything like that that I may need, consent forms, things like that that weren't signed within Patagonia Health. Work that was created outside of Patagonia Health that I want to incorporate into the consumer or client or patient's record, whichever you may call it, so that I have the whole patient care, right? So we want to see that whole patient, not just the things that we are doing and that we are responsible for. So I have that over here because that helps me. I've got my time and effort app, and we're going to go through this extensively today. I've got my caseload, right? So anybody who's doing case management, care coordination, any of those sort of variations may have a caseload assigned to them. Social workers, right? I've got a caseload. So the caseload app allows me to see bits of information about the patients that are under my care. Or if I'm a supervisor, I can see what's going on with the people that I'm supervising and their clients, patients, or consumers. So we've got alerts that I can see over here if they have any alerts. I can see the patient name. This blue will hyperlink me to go into the patient's record, their chart, if you will, so that I can see it. I don't have to look up. I can just go quickly. Their medical record number, programs, right? So these are the different programs I have loaded in Patagonia Health for me, right? But if you're a Patagonia Health client, you're only seeing the things that you do. So you wouldn't have to sort and filter through this list. So if I only wanted to see case management, for example, or breast cancer screenings or the preventions, etc., I can see that. In this case, I just want to see it all. The provider. So who is the one that is delivering the services? If I wanted to see just mine, I could filter on just me. I'm going to leave this at all because it's just easier. I've got a start date, a comments date. So here's a note that says notes about referral, the priority, and the status, right? So on this caseload app, I can see the different statuses as we work that patient through our care management, case management, and then the last note date. So we'll talk a little bit more about this. Patient referrals, a large part of what we do in case management is that referrals out and then making sure that we're tracking them from the appointment pending to the patient completed. And these, of course, would be your statuses that we would have there for you. Other things like today's appointment. So who am I seeing today? Who am I scheduled to see today? I use this as an example. We built a state-specific app, so like a West Virginia BSEP program, and that's a case management. Okay? Hold on. Is it possible to track specific service delivered by code? Ooh, David, yes. And let me just make sure by code. I'm going to show you that. So if you can hang on, I've got you. Awesome. Thank you. Messaging, right? So this would be HIPAA compliant internal messaging as well as messaging through the portal to the patient, right? So it's all HIPAA compliant. Pending encounters, if I'm doing any documentation, these would be the encounters that I need to come back. If anything were highlighted here in bold, that would mean somebody moved that to me. And you can see I've got 8 encounters. I'm doing actually pretty good. My other user login has like 465. So yeah. So that's just what I have. And I've got it in the order that makes sense. So if caseload is more important to me, then I leave that at the top. But since we're doing time and effort, I'm going to leave the time and effort at top. And that's going to help me see, this is going to help me remember to enter my time. So just real quick on this app, you can see time and effort. We can see the staff name, right? Because I, as the case manager, I have a supervisor. So my supervisor, I would move my effort to, and then they would see mine and theirs on their sheet. This can be used for payroll. This can be used for grant funding, right? Those types of things. I know in some states, if it's targeted case management or enhanced case management under 15 minutes, you can't bill for it, but then you can also get reimbursement, additional reimbursement. Here's the total time. Here, who's it's assigned to. So you can see this one on the 18th from yesterday is assigned to the public health nurse. So I've got 2 user logins here. And then what's the status? Once it's locked, it cannot be edited. So just like most apps in Patagonia Health, there's this wrench here. I think that's a wrench. I'll have to ask my husband. I think that's a wrench. But I can set my preferences, right? So preferences allow us to filter in data that we want to see, but more importantly, filter out data that is noise, right? So we want to make sure that you can have this personalized not only in the order of the apps, but also in your preference for what information you want to see. So I can see location, start time, description, served, and we'll see that. But the visible columns here, I want to show the creator, the miles, and if there's a per diem. So I'm going to go ahead and save those preferences so that now you can see in real time, it changes what the app looks like. So now I can see miles, per diems, who it's assigned to, etc. So if I want to, I've got 4 hours entered here. So let's go in and let's update this day sheet. I could add a new day sheet. So if I wanted to start tracking tomorrow, I can go ahead and do that. So what you'll see is it's defaulting to me and to the date. If I am supervising someone, then this drop down, I'll be able to see who I'm supervising. So if we're using this for payroll as an example, and staff is out, they're on PTO on Friday, but they forgot to add it to their timesheet, I can add it to their timesheet for them. So you can see here, we've got job task, the program, location, start and end date, the duration, description, number served. This would be mileage if we're doing this for like a home visitor program, or we're doing education, or we can delete this. So what I'm going to do is the job and the task would be your job and task. We've got some samples in here, things like an example task, shadowing staff, pet therapies, administrative, PTOs, public holidays, travel time for like a maternal child health home visitor, clinical oversight, family planning, whatever it may be. These codes can also link up with your payroll as well, because we'll be able to export this to an Excel or CSV. Patient outreach. So I'm going to just do enhanced or targeted case management here. And what's the program I'm in? I'll just say that I'm doing this for I'll do communicable disease. The location, maybe I drove over to the Raleigh location. I can put in the dates and the times, but I'm a simple girl. I just would prefer to put in the amount of time that I did this. Any questions on this so far? And David, I have not forgotten your question. Let me just give it a second. I want to talk about, let's say that I'm not doing an administrative task. Let's say that maybe I'm a community health worker, and I am going into the community, and maybe I'm doing a tobacco cessation seminar, right? So I'm doing some education. So let's just see. I think I've got we'll do weight management counseling, right? So maybe that's what we're doing that for, and we'll do case management, the location, the 4 hours, but the description, right? So we'll say we talked about healthy families, right? So that was the focus. What was the focus? And maybe we served 20 patients, right? So now I'm able to capture and report on what did I do, what was the description of what I did, how many did I serve, and then if I want to get the mileage that I drove, so let's say I drove 15 miles and I've got a per diem of $15. That is not taxable, but if it is, I can indicate that. And then I can save that. And now that is going to be part of my my work here. I'll also be able to see that miles and per diem here when I save this, because I changed my preference. So I'm going to save that. And then when I close this up, what you'll see is now it's showing the 15 miles and the $15 and the per diem. So we're able to see all of those. Now, if I'm done with my sheet today, then I can move this or assign this now to my supervisor, who happens to be me, but another role. So I'm going to go ahead and assign this to that user. And now you'll see that both of these are assigned to that public health nurse. So I'm done. I've moved it to them to approve. And I want to just pause for a second and see if we have any questions. David, you asked about tracking specific services. So what I'm going to do is I'm going to go to another screen. There's about 2 or 3 screens that every user is going to be on every day. I'm in the chart. So what we've done now is we've opened up the physical chart. We like to keep users on as few screens as possible. And part of that is being able to have this patient details. This is the registration file. That is part, I can pull this towards me versus having to go to another screen or anywhere else. So you can see we've got the basic demographic things. All these are reportable, right? Because that's what we need. All of these things are reportable. If there's fields that are missing, our friends in California usually need this California children's special number. We can add these for you. That's just what we do. There's no extra charge. I don't want to say it's a custom field, but it is a custom field because custom means money. This is not money, right? We can get photos and things like that. But we also have this service enrollment. And this is where we're getting to where we can track those services. So I'm going to go ahead And now I can add the service detail here. So if I wanted to, I could add this to maybe we've got some in-home outpatient, personal care services. It does. This can populate a timesheet and merge with. Let me just double check. Can this populate a timesheet? Yes, and merge with service delivery to produce a productivity report. Time worked to billable time. I'm going to double check on that. I may not make that sausage in the meeting here, but I'll get your information, David, and I'll follow up with you on that. So here we could make this non-medical. We could do case management, whatever we want to do. So we can link that. We can link it to the program. We can have start and end dates. We can have referral sources here. So maybe this was, from DSS. What's the status? Maybe they're in the waiting list. When we dispose of them, when they're done, any sort of information we want to hear. Maybe we want to see a treatment plan due 1/25, so we can indicate that. And then the primary here is what's going to populate on the caseload that we saw there. So here's where we can have that, and I can indicate that I'm the primary. So this is one area where we can track the service delivery. Another area, David, and I'm just going to show you this. Let's just say this, because this may be more what you're talking about. So we can also track authorizations, right? So if we wanted to track the authorizations, maybe I want to add a new authorization here. I can track the authorizations through its complete life cycle. So request submitted, approved, approved with changes always, right? Denied, inactive, archive, pass through. So I'll just say this one was approved. It was approved. I was the one who was the requester. Who's the insurance here? We'll do the Colorado, the authorization date, and the authorization number. So all of these things can be captured as we're documenting, which is where I think David may be going. As we're documenting, it will decrement these codes. So we can do visits, hours, units. So if I want to say we're authorized for 30, as we are consuming them, they are decrementing in real time. I can also do this by my dates here, but here's where my service codes are. Now, this is a pick list that I created, so you would have your own pick list that you would be able to create that would help here. So we can just do some personal care. Maybe we're doing some diabetes, etc. So we'll just capture those. So you can put in, these are the codes that will decrement this. And we can put in another filter if we want, and we can say it's in regards to this program. So we would have to be, the way it would decrement is this patient, this insurance, these service codes, or combination of the service codes and these programs. Does that make sense? So then as I'm documenting, this will go through and decrement those. I'll be able to see it here, as well as I'm going to save this. I'll also be able to see any of those at the very top here. So it will show me my authorizations at the top here as well. I'm going to look at that report here. Just give me 1 second. Okay. So are there any questions about how the user would enter in their data here? So I'm going to log out, and I'm going to log in as the supervisor here because I'm logged in as the case manager. So let me sign out, and I'm going to log back in as my regular public health nurse. And let's see what we got. So pop up, I always have the release notes pop up because that's easier for me to read them. And notice this user has a different setup than the other users. So from here, I can see my time and effort. I can see the staff name. So I've got 2 that have been moved to me. I'm going to double check on that. I don't know if the service codes and the payroll part are matching up. That's where I need to kind of play around. Because they're kind of separated right now, but I'll see if I can play around and get something. It's in there, so if we need to report, the data's entered in the database, we can create reports, right? That's kind of what we do. So I see the case manager here. So maybe I want to open this up and I want to look at what she's done. If everything is good there, I'm going to go ahead and lock this. right? No changes to be made. And then I'll do the same thing with her other timesheet. I'll review this and I'll go ahead and lock it. That means that I've approved of this. I can do my own or I can move my own to my staff. But I wanted to go through and show you what the reports will look like. So I'm going to go into, and this requires special permission, right? You need to be a practice administrator in order for this to show up, in order for you to have access here. And so I am going to, I'm going to go to reports, and you'll see the different flavor of reports that we have. So here I've got a payroll report, hours by employee report, staff leave time summary report, and then a time and effort detail. Let's start there. And I'll just do for the past 2 weeks here. If I wanted to filter more, so let's just, I can't believe it's the 19th. If I wanted to filter by program or multiple programs, I could. If I wanted to filter by staff or multiple staff, I could as well. I'm going to go ahead and generate this one. Every report in Patagonia Health, we're able to export to Excel. So that's a good, it's your data, right? So you export it, you want to upload it into something else, you want to transpose it, you want it to be pivots and pie charts and all of that. You do what you want to do because it is your data. So this is the time and effort detail report. I'm printing it to the screen here. I'm going to drink the water. Awkward silence. Okay, so let me write this down. So we want to do service code. Be a problem during a specific time period. Okay, let me play around with that for a second. Did I hit it? Let's try export Excel and see what happens. Maybe I need this like that. So helpful information here. Almost all of our canned, if you will, reports will have this helpful information. It's going to display the time and effort for chosen date range, which I have there, including date, staff name, program, job, task, location, description, start and end date, duration, served, mileage, etc. I don't know why that's not working. Okay, I have no patience whatsoever, so we're going to abort that for just a second. This report is going to give us a payroll. So this is going to show time and effort specific for a chosen date range, which I have in there. And it's going to have all of that information. And the demographics is going to pull mine. Come on, I know a report's going to pull. Okay, so this report can further be exported to Excel, PDF, or Word if you need it to. And now we're going to see we've got the staff, the ID, the family planning. So these are the programs. This job task is med inventory. Here we've got the date, the duration, and the total. Here we've got homeless Val. Maybe they went out and they were doing some blood pressures and dispensing some meds and things like that. So we did 4 hours. So that's what this is showing here for the payroll report. So however your payroll can have it, we can do that. In the staff setup, this is where we would have that mapped to the employee ID that they have in the payroll system. So you'd be able to see that. Other reports, let's look at hours. And I'll do, again, just to kind of limit what we've got here. I can filter again on the program and the staff. And so this is going to be the time and effort for the date range. And it's going to display all of this good information. I do enjoy helpful information. So this is showing the two that we know. I know that I entered it in here. So I've got the case manager. She doesn't have an employee ID. That's fine. The programs, the subtotals, right? So 12 hours here, 4 hours here. So a total of 8. And then here is Jolie. She's in her, that's 16 for this one, and then 8 for me here. And again, this can be exported into any format that you'd like it to be. Staff leave time. So this was another request. I don't think that I have any leave in here. So it's probably not going to pull anything, but maybe it'll just pull some zeros for us so we can see what that looked like. So this would be, it did, good. So this is showing the job task. So this is showing all of those details. We could export this and this would be able, then we'd be able to see what was just the PTO that the staff had taken. It's getting into the more detail, and let's try this one again. I'm a hopeful girl. How do I just do all? Maybe that was my problem. And see what this one pulls. Our report is not having fun today, but that may be user error over here. David, if you could, if you don't mind, what I would like to do is get your contact information from Denton, so that I can follow up with you and see if we can't talk about this report that you need. If I can get some details, then maybe I can help you with that. Other than that, let me just open it up for questions from anybody. That's pretty much what it does, right? It kind of is what it is. It works. It gives you that time and effort. Okay, good. Oh, David, you are wonderful. Okay, good. Let me just do this. Thank you. Email to myself. Wonderful. Thank you for that. I definitely want to follow up. Anybody else? You got any questions for me? So, Time and Effort originally started with a group in New York State, and they needed to track their targeted case management. And then we had a group in Michigan who was like, we kind of like to use this for payroll. So we made some modifications, and then we've continued to enhance this. It started off as Time and Effort, and I think now it's Time and Effort too. There may be a three. Um, the whole point of that is to tell you that our software is driven by our customers, right? So we don't have a development team that's out there doing market research to see what are public health departments buying. What we do is we provide an ideas portal for our users, and they can go in and they can add ideas. They can see other ideas that folks have requested. If they like what the other person, the other county has requested, they can up like it. I think you get 5 up likes. Oh, I hate it when that happens. I got you. I got you. One second here. I have got the correct one pasted in there, David. Thank you so much. I, for some reason, mine's Jolie, and I always get a K in there somewhere, so it looks like jokey, which is kind of funny. But the ideas portal allow our users to drive the development. So whatever is at the top, so whatever has the most up likes, is going to be what we're going to add to that roadmap, right? We want to do the development in parallel with our users so that we make sure we've got the right workflow, so that we're not missing some subtlety because we're not working in a public health department or a behavioral health agency every day. And so we want to make sure that we listen and that we respond, right? So this is something relatively new for us within the last year, that we've got this ideas portal, and it has been very well received, where people can actually have their voice heard and then see that it comes out in the development. They're like, wow, I did that. So that's really good. What else can I answer for y'all today? One thing that I will show you, because we just have a little bit of time and I'm not going to take all your time, but I do want to show you something that might be unique for us. So we're a roles-based access control system, right? So that's a big word that just means we're going to develop the roles that match your users, right? Not everybody's front desk does the same thing. Not everybody's biller does the same thing. So what we've done in the past is we created these standard roles for you based on what their job description is. Just recently, we created or added the ability for you, meaning the users or admin users, I would say, to create their own custom roles, right? So if I wanted to add a role here, I can do that. And maybe I want to call this, like a nurse level 1. Now I can go in and decide what permissions they have. So can they read allergies? Can they create, update, and delete? Well, this is a nurse. I want them to be able to create, update, and delete. bed management, behavioral health forms, the calendar. Yep, I think I want this user to be able to do some advanced configuration here and maybe copy, right? So now I am able to create this specific role. Maybe they're doing HIV case management. Maybe they're doing mass vaccination or maternal child health or some of the BSEP programs that are essentially case management. So now I go in and I can save this and then assign it to that nurse level 1. The other thing that I can do is if I'm creating graduated roles, once I save this, and I'm going to cancel here, once I save it, I now have the ability to copy that. So I can do nurse level 1, nurse level 2, nurse level 3, or maybe it's front desk 1, front desk 2, supervisor, front desk, right? So we're now able to do that, and that's something that we did before, but it required a ticket or things like that. And the ticket system is not difficult. You may have noticed on every right-hand corner of the screen, we do have a help button. So I could ask a question, how do I type? That might be one. And then I can see what the answers would be. I could go to the support portal. Y'all, our support portal has all of our videos, all of our training. It's got quick reference guides. It's got knowledge-based articles, billing tips, things like that. It's really a great resource anytime you need it. But if it's not here and I'm just like, I just need some help. So now I can put in my name, email, the subject. If this is about a specific patient, I can put in the description. I can even give the support people a screenshot or upload a file, right? So we're trying to make this easy. The support portal allows you to manage your tickets, right? So if you say, I asked how to run this report last year, let me go look back in my history and see if I can see the instructions for running this report again. So it allows you to see what's the status. Have there been any updates? I need to go back because I can't remember how I did it because it's been a year. So we do that on every screen to make our support easy to get to. But you can also email and call and all of those other things. We just want to make sure that you're able to get in touch with us the easiest way. I'm going to give it another minute. If y'all don't have any questions, I'm just going to thank you again for hanging on with me to do this webinar. And I apologize, but you would not have been able to hear me. I was so squeaky. I sounded like Bobby Brady going through the change. It was really embarrassing. And I didn't feel good either. So. And I don't think we have any more questions.
All right. Well, thank you so much for doing this awesome presentation, Jolie. And thank you to everyone who joined today. If you want to watch this again, it will be up on our website very shortly. But again, thank you for your time, and everyone have a great rest of your day.
Thanks, y'all.